our toolbox, we probably have 100 tools in there. It's the how. And it's the how that when in your different cultures, because I think the hospitals do have their own cultures that are unique, is they're reflective of the community, they're also reflective of the staff, and it's the how. So that's what you pick up in conferences like this is, like, how'd you get to that point? And how'd you overcome some of the barriers and challenges? And that's kind of my note taking, going, oh my God, that's brilliant. And usually it's simple, right?
It often is. It's so true. It's so true.
Yeah. But it's sharing, you know.
I think we could do more to get that information and to see the impact of how we're delivering care. So this conference has been very great today to, give me some ideas, starting to do some brainstorming that I can take back and maybe not knowing all the challenges because we haven't done a lot in terms of engaging patients to sort of give us their experience and to change things based on that.
Really what I wanted to be interviewed about today was the fact that this is a patient engagement conference. And I feel as though my experience here kind of reflects my experience across the board, that everybody here is a hardworking, intelligent, wonderfully motivated person. And there's this wonderful, I don't like to use the word movement that was mentioned earlier today, but it's like a movement in a way, but it's a wonderful process that's happening.
That's great to hear. And then lastly, what were you hoping to get out of the conference?
The networking and meeting other people who are doing this work. I think it's great to get that. And I'm also really excited to hear examples from across Canada because there's such a diversity in how things are playing out from coast to coast. So hearing about that has been a really neat experience.
That's great. And so it's great to have you here.
Yeah.
And so lastly, what were you hoping to get out of this conference specifically?
The intent was really to understand what's out there in the industry. We don't want to reinvent, right? Because if something is already being done in some places as best practice, we would want to tap into that resource. We do that from there and basically take it to the next level from that place on. So that there's this information sharing which is happening in this session, which is great. A lot of information which we were not, clear about, or we did not have a partake to, is being made available as a part of the center point where people bring together different practices that their organizations are following, and this helps us in terms of understanding what is out there in the marketplace at this point in time, what other hospitals are doing that there is an opportunity for us to tap into. So this is a good place to start from that perspective.
You spoke this morning as well, and you're also sponsoring the event. How would you describe your overall experience as a speaker and as a sponsor?
Oh, I think that the conference is very, very well organized. It's great to talk with people that are like-minded and share the same passion. So I think it's a fantastic conference. I'd be back again.
And how would you describe your overall experience at the event so far?
It's been great. I believe everybody here is, at the same goal. Everybody wants to improve the patient experience, and these are all the people that we want to talk to. So it's been a great conference.
I've worked with over 100 organizations around North America, and I have to say this is one of the best conferences I've attended in all the years I've attended conferences.
I actually think we're in a really good place, and actually the conference has been great in kind of reiterating to me that we're on the right place with some best practices, and yet there's lots of pearls for me to take back.
What are you hoping to get out of the conference, and what have you gotten out of it so far?
So, the one great thing about a conference like this is just the connections with other people doing great work. So it both is validating in some ways when you're hearing people talk to say, oh, we're doing that, and that is a best practice, and we're doing well in that. And also to say, oh, they're really doing something different, and how can I take that back and see how it can enhance what we're doing. So connecting with other people so that I know I got contacts afterwards to call up and learn more from, validating what we're already doing and the best of, and then really seeing other possibilities that I can take back and engage with my team around.
Excellent. And so what would you say that you got out of the conference for these past 2 days?
I was really impressed with the diversity of the attendees at the conference, which confirms for me that we're all interested in making a difference in the patient experience, and we're all working on similar things. And for me, what I heard is very much working with our partners within our organizations observation might be we still need to do a little bit more work working across the continuum of care.
That's excellent. And so lastly then, what would you say you've gotten out of the conference these past 2 days?
I think the last 2 days have been very helpful to see the ideas that are coming forth from organizations that have been working towards ensuring that patient-centered care is moving forward in their organizations, but also those who are just starting, to hear the questions and to learn from each other, but also to be able to teach each other what obstacles might exist, what opportunities, but also to realize that there's always opportunity to move ahead and to improve the quality of care that we provide to our patients and their families.